Hello, everyone. This is Professor TJ Land from Main Campus, Nursing 421. This content clinic is a content review in preparation for Exam 3. It actually covers topics 6, which is leadership, 7, which is professionalism, 8, which is communication, 9, which is patient-centered care, and 10, which is collaboration and teamwork. So we're going to go through these individually. The first module that we're going to talk about, as you can see, it has purple all the way across, including application and analysis. Now, on our past exam reviews, we actually saw some that were at the understanding level or application level. Now, you may have questions of any level, including up to, and the most of them are going to be application and analysis only. Please note that with these 5 components, each of them account for 15% of the exam, which means that each of these will be created by approximately 7 to 8 questions covering that particular topic. So the first one we're talking about, the leadership. Leadership, the first one, it asks you to be able to define the role of the nurse as a leader. So you need to be able to tell me an answer to what does it mean that an RN is a leader? What does the RN role as a leader look like? Is patient and colleague advocacy included in this role? Well, yes, it is included in this role. RN as a leader is someone who actually leads because they advocate or because they educate, or they have the responsibility of being accountable even though items were delegated. So the RN role as a leader, what might it look like? Well, this is where we're talking about the different kinds of leadership styles. But first I want to make sure that we're talking about the same thing. So formal leadership and informal leadership need to be clarified. Formal leadership is an RN who is actually in the position where it is an actually recognized leadership role position, such as a charge nurse, a team leader, a manager, a supervisor, a director, a nursing officer. Now, an informal leader is someone who is a staff nurse working on a unit or in a facility or even home care that is typically the person that you see others on that area, on that unit, on that particular facility. They go to that person to seek guidance and advice and ask questions. But they are not in a leader role. They're not in a formal leader role, but yet they are the person that the people go to most often because they trust them. And they get their answers. And they also feel like they are equally respected by this person. So taking that into mind, you need to think about how the role as a leader, what it might look like. The other component of what it might look like is the leadership styles. So we're talking about being a servant leader. That in the PowerPoint slides talk to you about the fact that a servant leadership is someone who helps others grow. They're not in it for themselves. They are in it to help others make progress and even surpass them in whatever the endeavor is. So that's a servant leadership. It's all about the building up of others rather than themselves. Transformational leadership is all about the change, being a change agent. being the person who's going to make significant changes for the better, to improve outcomes. And it's usually someone who has listened and made a plan, and now they're implementing that plan. Be sure to recognize that many leaders utilize a variety of different leadership styles depending on what the circumstance is and what the situation is. And actually that's being a good leader, being adaptable and addressing the situation based on what's going on. The other component to that is quantum leadership, and that's a servant leadership organization. That's an organization that everybody is working towards the betterment of the others. Grand Canyon University would be a representative of that they are a quantum leadership. They are quantum. So looking at objective 2, it says you are to explain professional behaviors in respect to the tolerance of different viewpoints and valuing individual contributions. So first of all, what does that mean? How does that fit into being a component of a nurse leader? And what kind of characteristics and behaviors do you think the nurse leader needs to demonstrate to show or accomplish this tolerance or valuing? Really what we're talking about here is the recognition of and using diversity to the benefits. Okay, so keeping your eyes and ears open, controlling your own biases, looking at other people's perspective, thoughts, culture, and keeping an open mind. Just because you don't do it that way doesn't mean it's wrong. And that's something that a tolerant leader would recognize. So the third objective is talking about you being able to analyze clinical reasoning as a problem-solving approach. How can we use clinical reasoning? Okay, so what might be an example of this process? Well, how about your nursing process? It is a problem-solving process. And it's actually used in a variety of different organizations to go through problem solving. We have to look at the problem, and we in nursing call that an assessment. Then we got to figure out, okay, so we've looked at it, and what's the matter with it? What's going on? Well, in nursing, we call that a diagnosis. The other places say, okay, now that we know we see it, we know what it is, what are we going to do about it? In nursing, we call that a plan. When they do whatever it is that they think they need to do about the problem, it's in nursing called an implementation. And of course, anytime you do something, you need to evaluate whether it worked or it didn't work. And that's what we also do, is we evaluate. Please remember that experienced nurses typically do not always write down the plan of care. Basically, they do the development of the plan of care in their heads. They do an exam, they do an assessment, and then they develop that plan of care in their heads. They do not always verbalize it, and they do not always write it down. So that's something you may want to ask some of your nursing that you're working with. Okay, so you've done the assessment, so what is the plan? And how do you come up with your plan? That might be something that you want to do, because you need to be able to do and create a plan, whether you speak it out loud or not. So ADPI, use your nursing process. That can help you figure out problems not only in nursing and healthcare, but also in your private life. So number 4 is asking us to be able to illustrate the principles of accountability and delegation. So you need to understand what are those principles, and you need to understand how you know when and to whom to delegate. Then, of course, we have what kind of publications and laws help us define those delegation decisions. Well, the principles are the rights of appropriate delegation. Then, how do you know when and whom to delegate? Well, that's all related to what is in their scope of practice and have they had the appropriate training for them to be able to do it independently. So what kind of publications and laws help us define that? How about the State Nursing Practice Act? How about the LPN Practice Act? How about the CNA Practice Act? Those laws help us determine what is and is not within a scope of practice of a particular educational level, especially with dealing with nursing and healthcare. So Objective 5 says that you should be able to appraise the ability to take initiative and accept accountability for actions. So just think about this for a second. How might a nurse show the behavior of accepting accountability for their practice, their actions, or their decisions? So might this be that if somebody made a mistake, they say, yes, I made a mistake, and they don't keep it to themselves, they don't hide it, they don't cover it up, and then they actually do something about that, such as reporting it to the charge nurse or the director, and includes completing an incident report so that that can be put into the database to see if others are having the same issue that you did or that nurse did. Okay, so the next module is Module 7, and is talking about professionalism. This one is pretty easy, but it's pretty encompassing. It's actually kind of hard to explain what professionalism means, just like it's kind of hard to explain what nursing does. What is it that nurses do? So let's talk about professionalism for just a minute. The first objective says that you're supposed to be able to explain how the ANA's scope of standards of practice, and then the social policy statement and their code of ethics relates to the daily professional nursing practice. So how are you going to use your scope and standards, the social policy, and the ethical code in your everyday nursing practice? So the scope of practice tells you what you can and can't do based on your education. And then, of course, your social policy shares information with you about interacting in public and how do we share what we are and what nursing is to the public. Then, of course, we have the code of ethics. You are going to use your scope of practice and your code of ethics on a daily basis. Once you get out in the interactions of the social world, you're actually going to start using the social policy almost on a daily basis. So I need you to be able to explain how the scope of practice, the social policy, and the code of ethics can be utilized in helping you go through your shift. So the second objective says that you should be able to describe examples of client advocacy nursing intervention plans for an individual, family, or community which incorporate components addressing improvement in future client outcomes. Essentially, this says that you need to be able to understand the responsibility to be aware of, knowledgeable of, and adhere to all aspects of the current laws and the relevance to their practice. Sorry, I skipped one. The advocacy component. This is where you're providing examples of the patient's advocacy and nursing intervention. Essentially, this is what you did in your advocacy assignment. You did the assignment. That shows me that you are able to provide an example of how you go about doing an advocation and then, of course, implementing nursing interventions and plans. So now, I'm sorry, let's go to number 3 now. Number 3 says you should be able to summarize the significance of recent state legislation to the practice practicing professional nurse in your state. So this, again, goes back to being able to understand the responsibility to be aware of, knowledgeable of, and adhere to all aspects of current laws and the relevance to their practice. So your Nurse Practice Act for your state. The other thing is, if you go to the Arizona State Board of Nursing, they have some headings across the top, and one of them is about regulations, laws and regulations. And you can click on that and look at legislation. That will share with you some of your most current information. Another way that you can look at this is like the federal law of the Affordable Care Act was implemented. States were given the opportunity to either participate in the federal ACA, working with Medicare, Medicaid issues, or they could elect to do their own. And so there were many states who went one way or the other, but you're going to be able to find out which way your state went by looking at your state legislation. So number 4 says you should be able to describe 2 ethical client care situations that you've observed in the clinical environment and how each of them were resolved. So these are, of course, the situations that we've talked about. How about a physician pushing someone for an abortion without allowing the patient the opportunity to consider the options? How about the withdrawal of care, extubation of a patient, when the power of attorney says yes, the medical power of attorney says yes, but another child says no? How about the conflict of the living will, where the patient has asked for a DNR status and a family member says, no, I need you to do everything, but yet that goes against the wishes of the patient. So these are the kind of ethical dilemmas or situations that you're going to be able to, or you need to be able to discuss and explain. So Objective 5 says that you need to be able to explain your plan for giving and receiving constructive feedback to a nursing colleague with a rationale for that approach. Well, first we have to figure out what is constructive feedback. What does that mean? And then what kind of approaches might you use? Well, this was the second part of your advocacy CLC project. You were supposed to provide constructive feedback to your colleagues within your group. Now, I know that this was difficult, but in the future this is going to be pretty significant for you. Let's say that you have actually done an implementation on your unit based on evidence, and it has been working and improving outcomes. And so your director has asked that you create a presentation on the information about the implementation and how it's working and that kind of information. So you're going to create, and then they're going to send you to the American Nurses Association convention so that you can present your results. You create your presentation and you provide that to one of your colleagues. Well, if they do not give you appropriate constructive feedback, might you become embarrassed by spelling errors or the fact that you did not do any citations but only did the references, or that it's not a very good flow, that the outline is not making a good flow of how you want to present this. And the only way to figure that out, because you've been looking at this all the time, you see it. You don't see the things that need to be changed anymore. You just see it as being right. Your colleagues need to be able to provide you with that truthful, constructive feedback, because you do not want to embarrass yourself. You do not want to embarrass your facility and then have to come back here and yell at that colleague for not doing what you asked. We are not doing this to be mean. It is all in the opportunity of making things better and bringing people up to their best abilities. So now let's talk about the next section, which is talking about communication. The first component of communication there, it says that you need to be able to analyze the principles of effective communication. So what are those principles, and how might you use them for effective communication? You just need to understand, it's a two-way street. You also need to understand the three different kinds of leadership styles. So there's the passive, there's the aggressive, and then there's the one in the middle, that's the assertive, and that's actually the communication style of choice. Number 2 says you need to be able to differentiate elements of effective written, electronic, and verbal communication, including conflict management. So what that means is you should be able to explain or be able to describe the pros and cons of effective communication, be that written, be that electronic, such as a text message or an email, and be that verbal communication, such as via telephone or face-to-face meetings. And how would you, as the professional nurse, appropriately manage conflict in relationship to communications? You would not want to discuss a conflict in an email because tone and body language and perception are not present. Whomever is reading that will put their own tone to that email, to that text, or to that tweet. And whatever email or tweet they've read first can impact what kind of tone that they apply to your message, appropriately or not. So is that some way that you want to actually manage conflict through those kind of interactions? And I'm going to say the answer will be no. The best way to handle conflict resolutions or situations is to do this in a face-to-face. You need the added components of facial expressions, body language, the tone, being able to look in their eyes and see if they are willing to meet your gaze, for looking for truthfulness. Those things are going to be what you need when you are looking at conflict resolution. And so you need to be able to describe how each of these communication styles could be used and when they should not be used and why. The third objective is that you should be able to assess the client's ability to communicate, including barriers of effective communication. So what kind of things would you as a professional nurse assess prior to communicating with a patient and their family? One of those things might be their health literacy, or how about just their regular literacy, their education level, period. And then, of course, their health literacy on top of that. You also want to make sure that when you're talking with them that they understand what you're saying or requesting. What kind of communication barriers might you experience in a daily patient care situation? Well, here in the state of Arizona, we come across those frequently every day. English as a second language is a huge barrier here, and not just as Spanish as a second language. We also have African, Asian. We also have Hawaiians who use their native language, Chinese, Japanese, Filipino. We have a variety of languages. We have a diverse melting pot here in Arizona. So those barriers might happen. Another barrier might be that the patient has no idea what the physician just explained to them. They did sign the consent because they kept nodding their head, yes, yes, yes. And when the physician provided the consent form and the PIN, they signed where he said to sign. Then when the physician leaves and you get an interpreter in there regarding something else, They're going to say, you know what, I don't understand anything he said, and what are we doing and why? So another barrier might be that people do not question authority, or they do not question physicians. That has been an issue for quite some time in American healthcare. So those are the variety of barriers you might, and it's just a few, for you to consider. Another barrier might be someone who cannot speak, they're mute, someone who cannot hear, or someone who cannot see. These barriers do affect communication. Number 4 says you need to be able to establish steps to adapt communication strategies and tactics based on the needs of the client, family, and caregivers. So based on the things that you might recognize as barriers, what might you do to adapt communication strategies and tactics to overcome that, and then help improve on the care expectations and make it patient-centered? Number 5 says we need to be able to appraise factors and interventions related to health literacy in order to improve the health literacy of clients and families and encourage better health self-management practices. Well, this is where we actually are moving towards preventative health care rather than reactive health care. One of the biggest things is if we know what their literacy level is, and then their health literacy level, their communication ability, and any barriers to that, we actually can make a difference and explain things to patients so that they have a better opportunity of doing self-care and doing preventative care rather than waiting until something has happened and then doing reactive care. So that would be an excellent way for us to address moving towards self-management by patients. Number 6 says that you need to be able to analyze effective communication procedures regarding a nurse-to-nurse transfer of client responsibilities to promote positive client outcomes and prevent avoidable medical errors. Well, pretty much it's asking you just what kind of recommendations have been made to improve nurse-to-nurse transfers of patient care. And how does it help prevent errors and promote positive patient outcomes? Well, what we're talking about here is SBAR. SBAR, making sure that you're communicating the correct information in the correct fashion at the correct time to the correct person. And then, of course, pertinent information. That's important that we look at pertinent information. If we are wasting time on, yep, she has 6 grandkids, and is that pertinent for what I need to know when I'm considering the fact that she's short of breath? No. So we can actually improve patient care by cutting down on impertinent information. And SBAR helps us cut across that chronic continuum of care coordination that we actually have. So topic or module 9 is where we're talking about patient-centered care. So the first one says you should be able to prioritize processes involved in client care coordination. Didn't we just kind of talk about that when we were talking about SBAR? I do believe we did. So what it means is, how do you as a nurse prioritize? Who needs to be seen first? And when you do see a patient, what needs to be done first? How do you prioritize that? And the biggest way for you to do that is, of course, to use a priority template. Well, do they have a patent airway? Are they breathing? And do they have a pulse? Now, it may not be a good pulse, but they do have a pulse. So now I can move to assessment. And once I assess, then I can implement. I cannot implement until after I have assessed, because I don't know what to implement. And if I do the ABCs to save their life, and then I do the ADPI to assess and implement, and neither one of those really do help me answer the question, then I have to go to Maslow's hierarchy and look at physical safety, before I worry about psychosocial issues. That template will help you prioritize who to see first and also what to do first when you decide on who you're seeing. The second objective says that you need to be able to analyze relevant clinical scenarios from the perspective of the client. So what that means is, how do you as a nurse ensure that the patient is the focus of your care and not nurse convenience? And you also need to recognize what the patient may be going through. What experiences are they having? Look at it from their point of view. The third objective says that we need to be able to appraise the role of the nurse in relieving pain. So what do you think your role as a nurse is in pain alleviation? This one gets pretty complicated because we have to think about the patient as holistic. So do we always have to use pharmaceutical interventions? The answer is no. However, we do need to appropriately manage people's pain, because when we do not appropriately manage their pain, this is how patients become addicted to pain medication. Some of the other forms of alleviation for pain that are not pharmaceutical might be repositioning, massage, back rubs. Now, if I want acupuncture, that's invasive. I would have to get a prescription order from the physician to allow acupuncture to occur. But I can do acupressure without a prescriptive order. How about warm compresses for an IV site that is infiltrated? Can we do that? Sure we can. How about looking at biofeedback, Reiki, guided imagery? All of those things can help us assist in addressing pain. The fourth objective is that you need to be able to explore nursing care that meets that holistic need of clients, where it is related to the socioeconomic, cultural, ethnic, and spiritual values and beliefs that influence healthcare and nursing practice. So we kind of talked about addressing pain in a more holistic way, and that's your role as a nurse to be able to do that. So now, moving to the next one, is what does it mean when you as a nurse are providing your care in a holistic fashion? Pretty much what I want to share with you is that we are not looking at just the lungs, such as maybe a pulmonologist would do, or just the heart, such as a cardiologist might do. When we look at a specific system, we also have to look at, okay, so how is that system impacting the rest of the patient? And how is the rest of the patient affecting that system? What kind of values and beliefs does the patient have, and how will they impact your ability to provide care holistically? So if a patient believes in Reiki, then let's consider that. If a patient believes in Tai Chi for stress relief, let's facilitate that. That's what we need to do. Whatever they value and believe, we need to try to advocate for that and get it done. Number 5 says that we need to be able to examine the inherent worth and uniqueness of individuals and populations. So kind of what does that mean when a nurse thinks about a worth and uniqueness of a person, people, a community, or even a population? Well, everyone is able to contribute. One of the ways I like to explain this is goodwill. before the Goodwill came along and the American Disabilities Act came into being, people with disabilities or, quote, challenges were actually shunned. There were no ramps for people with wheelchairs to use. Sometimes they couldn't even get into their physician's offices because there was no way for them to access it, depending on what they had going on. And of course, if they couldn't even get in to see their physician, they were not going to be working. There was a stigma applied to them. The Goodwill actually helped change a lot of that stuff by being one of the first organizations that actually hired disabled people on purpose and gave them an opportunity to be productive. So they would get a training. People would be taught technical skills such as how to repair a refrigerator, how to repair a television, how to repair wood items like a bed, a desk, or even a computer desk or a dresser. When they had those skills, then those people were given opportunities to do things in centers that people dedicated their handoffs to, or some items that they no longer needed or they outgrew. And that means the profit from those things are then put back into the system because these are 501 not-for-profit organizations, and then more people have the opportunity to become productive. And I have to say that the uniqueness and the productivity or worth of people is extremely important, extremely important. And nurses need to consider that at all points of when they care for people or populations. The last one on patient-centered care is that we should be able to distinguish the need for client input in regards to the personal and cultural values, preferences, and needs regarding their healthcare decisions. So let's look at it this way. Why does nursing feel that the patient's input on decision-making is important? How do the patient's values, beliefs, and preferences affect that decision-making and affect on how you provide patient-centered care? You already know this. We've kind of talked about this already, so I'm not going to go into much more detail on that. It's all about making the patient the center of our universe when we are caring for them. And then, of course, respecting what their personal preferences are. We need to respect people and treat them with dignity. So the last topic or module for exam 3 is module 10. This is on teamwork and collaboration. The first objective says that you need to be able to explain the importance of effective communication as a risk management component when clients are transferred to another healthcare provider or facility. Well, that kind of goes back to one of the IOM chronic issues when we talked about the inability of nursing and healthcare in general to be able to effectively do care continuum, care coordination for patients, hopefully using the SBAR and effectively communicating with people and actually making the effort to ensure that the appropriate people have the information that they need to be able to do an effective job. That matters. And so communication is a key component to both collaboration and teamwork. So you need to be able to tell me, what does it have to do? What does communication have to do with the collaboration and then teamwork? How are collaboration and teamwork different? Collaboration is where everybody comes together and they work towards a common goal. But that doesn't mean that they all are focused on the same thing or have a passion about one particular goal. That would be, so collaboration would be a provider that is a general medicine, and then a provider who is pulmonary, and then a provider who's cardiac, and then a provider who's GI. Those people can come together on a team with respiratory, physical therapy, nursing, and dietary to make a collaborative team. They are all looking at the patient a little bit differently, but the ultimate goal is to send the patient home. Does that mean that the medical doctor and the cardiologist are going to agree on how we get there? No, just that we need to get there. However, when we're talking about a team and teamwork, everyone in that group has a passion for the same goal. We all agree that that is the goal, and we all agree on how we're going to get there. There's a passion, a dedication. And teamwork comes from a group of collaborators working together, getting to know each other, and then, of course, addressing each other's strengths and weaknesses. So if I have a strength on something, that should be my assignment because I'm really good at that. And if I have a weakness, maybe somebody else has a strength on that, and it should go to them because they can do a good job at that. And in a team environment, that is exactly what happens. People start working on more towards their strengths, and then as others have strengths that is your weakness, you actually kind of meet with them and see how can you improve upon your weakness based on how they got it as a strength. Objective 2 talks about you need to be able to establish a culture of effective team functioning by adapting communication styles to assert positive contributions and perspectives related to client care. So what that means is, what do I mean when I say effective team functioning? Well, I kind of addressed that in the fact that they are all working towards a common goal and they agree on how it's going to be done, how it's going to get there. But if we do not communicate well, and we do not have good communication styles, like if somebody's passive and we have somebody that's aggressive, the communication style is going to be the aggressive person is always going to be making the decisions, and the passive person who actually has other skills is not going to interact and provide information. So this is not a well-functioning team. But if we can balance that and try to work towards an assertive communication style, then we have better team functionality. Objective 3 says you need to be able to examine the concept of lateral violence as a barrier to teamwork and unit functioning. Well, first you have to know what lateral violence is. It's something that you discussed earlier on in your education. And then how would it be a barrier to either a team or a unit function? Well, utilizing the passive and the aggressive communicator styles, that alone can show lateral violence, especially when the aggressive style communicator does not allow someone else to have a say or make any comments or participate in any decision making, or if they go, okay, you need to be quiet and sit down, I'm going to take care of this. Well, that's not a team. That's being a bully. That's being in command. But we don't need somebody in command in a team. We need everybody to take a component of this and then work together. So when we cannot function as a team, and not everybody does the participation to their best ability and to the full extent of their abilities, then we're going to have barriers to how effective the team or that unit is going to be. Objective 4 says you need to be able to interpret providers' orders correctly. So what does that mean, to be able to interpret accurately and correctly the prescriptions or orders of a provider? Let me clarify for just a moment. Any order that you receive actually is a prescription. You cannot go to a lab and get your blood work drawn without the provider sending a request for that. That is a prescription. You can't go get x-rays done without the provider sending the request for that. That is a prescription. Medications have been used as prescriptions, and we've utilized that term until now. Everybody associates prescriptions with just medications, when in actuality, it's any kind of order or directive that the physician or some other provider has regarding their care, someone's care. And doing it accurately and correctly, why would that be important? So if you misinterpreted that instead of giving Tylenol, you were supposed to give Tylenol 3 with codeine, and you gave them 2 regular Tylenol rather than 2 T3s, how is that going to affect your patient and your patient care? Is the pain medication going to be effective for your patient? No. How are you going to address it? And then that makes it an error. And how would you address that? You have to stand up and take responsibility and accountability for your actions. And then you probably will never make that same mistake again by learning from your mistake. The last objective for this exam is that you need to be able to identify the roles of authority and hierarchy in the healthcare workplace and their potential influence on teamwork and client safety. What that means is, what is the chain of command in a hospital, on a particular nursing unit, in a community service facility, in a long-term care facility? And then, of course, why is it important to know and follow that chain of command? And then how would any issues with that or that chain of command influence the nursing and patient safety, especially if it's not followed? So that's what you need to answer to be able to address that particular objective. Please remember that there will be 5 med-math questions, so be sure to practice your med-math calculations and pay attention to instructions, especially regards to rounding. You, as a nurse, need to pay attention to detail, so be very detail-oriented when you are taking your exam. Okay, so today we have just finished the Exam 3 content review for Nursing 421 for the fall of 2015. This is Professor Land from the main campus, and I want to say thank you for participating, and please do not hesitate to reach out to your faculty if you have any questions or concerns. Thank you, and good evening.